Today's webinar is Closing Streets to Create Space for Walking and Biking During the COVID-19 Pandemic. We hope you and your families are well and safe during this unprecedented and chaotic time that we're all currently living through. So a question for really for all of you on the panel, you all talked about a diversity of approaches of past experience that you're part of, whether it's traffic calming work to allow for temporary bicycle lanes, or ciclovías, or open streets, or Jim, the seasonal road closures for the snow season. So I'd like to hear from all of you, how do you think that that past culture that either your agency or your city had of already having experience with these kinds of measures, how do you think that that really enabled you to, move forward in your conversations about, taking action during the pandemic? Maybe we'll start. Sara, can I pick on you and have you start first?
I think Jodie essentially has alluded to the same thing. I think the comfort level of the different agencies was really key. And so I think for us, the comfort level was high because the closure was something that the city had a lot of experience with. I think many people also recognized the overcrowded nature of the trail on the other side of the river. Everyone was seeing it. It was extreme, and so I think that shared experience sort of led to a fairly quick decision. We were, in the sense that Philadelphia was just, we didn't have the same kind of, I don't know, I can't go into sort of exactly why our public health commissioner didn't weigh in like San Francisco's did, but that's what happened, apparently. But I think the having agencies being able to have sort of muscles exercised is really important. But the reason I sort of brought up our experience with the Pope is that I think what we're going through is when you have these sort of big, big events like the Pope coming and clearing out every car for a huge area, or the pandemic where your traffic is dropped by like a half or more. It does cause a big kind of shift in people's thinking about all this space that cities and towns have that is largely used by only one mode. And so it's we hope we can kind of continue to have that kind of bigger conversation to have more flexibility with the space than we have now.
That's great, thank you. Jim, do you want to chime in and tell us, what do you think enabled Duluth to act so quickly?
I think we have a leadership team led by our mayor that has a sophisticated appreciation that supporting Duluth through this crisis goes beyond simply depressing disease transmission rates and goes to supporting the broad emotional and physical health of the community through what is a collective trauma. I think also our leadership team is very tight-knit, brought together by the experience of working through 5 declared natural disasters in the last 8 years. And so we're accustomed to working across departmental boundaries and making speedy, wise, decisive choices on an expedited basis. So that's been a great help as well. Generally, this has been a pragmatic, public health-driven, emergent decision made as an integrated part of our emergency response, not as a tangent or distraction from it. And so, on the tail end of this, we're going to be interested to harvest any lessons learned there may be about alternative transportation. But our present focus really is on simply getting our community through this crisis well, physically and emotionally.
That's wonderful. Thanks, Jim. Laura, what are your thoughts?
Well, actually, for us was a key element that we already had the organization, the logistic, all the contracts, and what we done was taking these elements and put it all together under consideration of the mayor, and she said, let's go on. And so this strong leadership, and she's very convinced of bike use as a power element and a very good tool for climate change and a new perspective of the society. So it was, I think, a very good decision making chain. And then when we had articulated the management, then we can take decisions very quickly and put the people together to work. And also the data that we collected, because maybe someone have some doubts about what we done, but with this measure, the monitoring that we done, we can say, okay, we make this decision, maybe it wasn't very good, but we corrected, and now we implement or modified something.
That's wonderful. Thank you so much. And Jodie, do you want to add anything?
Just that, I think the biggest lesson for us for this was that our relationship with our head of Department of Public Health is not as strong as it possibly could be. And while we got buy-in from other people within the agencies that thought that this is a good idea and that we have the ability to do this and turn it around quickly, because it wouldn't be something new, it's something that we do on Sundays, it is something that we do on Saturdays. It was our city's leadership that was looking to our head of Department of Public Health for the final word. So us not having that direct line to him, but other people in the department, it wasn't enough to really get him to do what we felt we needed to do. He's also, his experience and his expertise was the AIDS epidemic, and so he has experience in trying to already, curb rapidly spreading disease and viruses. And so therefore, I think that our mayor is leaning on him to do this. And I wish we all had crystal balls to know like which method is going to be the best thing to use. Is it not giving people place to congregate, but giving people more space on our streets? Or is it just taking that all away and seeing how it goes? I think what people are really worried about is, as our city has closed the parking lots to the beaches and things like that, where people used to bring their dogs, they are now driving to Golden Gate Park to have that additional space. And so it's attracting more people into the park. And I think that we all fear that even Golden Gate Park is going to eventually be closed to all people. And so it's one of these things where you have to try to decide, where do you push to get the most that we possibly can get at this time.
Great, thank you so much. Question for you, Laura. You mentioned being able to rapidly pilot different approaches. And so what, the city's ability to try different things very quickly, what do you think you learned most from being able to try those things and then switch gears quickly?
I think we learn a lot about how fast can the behavior of different transport modes adapt, especially bike, pedestrians, and buses. When it is planned, we can complement together, because car use sometimes uh, it's hard to move it. So when we don't have cars, we can move the people more efficient. Uh, and I think it is also the culture of the people that the people in Bogota adapt very quickly, because most of them doesn't think or doesn't have something secure in a month or 3 months or maybe next year. Mostly of the people doesn't know what will happen. So we are very resilient. So we make a resilient temporary infrastructure.
Excellent, thank you. Question for Sara and Jodie. It seems like this is going to probably be going on for quite a while. And so, it might be safe to say that there's going to need to be, more, more open streets, more access to this space. So when you're seeing kind of the situation we're in and the long-term implications of the situation we're in, that it could go on for many months, what are you thinking when you're hearing city leaders say, we're dealing in triage right now, we don't have time, we can either give you nothing or we can implement this one piece but nothing else. But knowing what you see coming, kind of how do you continue to or do you continue to advocate under that environment when they're kind of telling you we're busy over here, but you see this really important need that's going to keep bubbling up over the next several months?
Well, I think just continue to be persistent and ask for an open dialogue and not and if the answer is no, then okay, well, return and come back and ask again. I mean, I think that the thing to we just right now we're talking to community organizations and our city council leaders just to gauge their their input and their opinion about opening up a few more streets or roads, park roads, so that the opportunity is spread throughout more of the city, so it's more equitable. And then try to start with a conversation with our city leaders. I mean, we're in the middle of the probably the worst part of the pandemic right now, and so we're just trying to take it one step at a time and work with the conditions that we have in front of us. So I think just keeping keeping lines of communication open and try to present various options that we think can help the city's residents all throughout the city and support their physical and mental health.
Excellent.
Yeah,
Excellent.
for us,
Thank you.
For us, this is JFK is definitely a long haul campaign. As I explained in my original, Market Street was a 10-year campaign. JFK for getting car-free space for 7 days a week has already been a campaign of ours and our partners at the San Francisco Bicycle Coalition. So this is something that we are just keeping the lines of communication open. We're trying to get those promises now, that this is going to be something that we can have for the long future, and maybe chip away at what we can get from post-pandemic. It's something that working with the supervisors or our city council members that are adjacent to the park, making sure that they're also on board and they see the need for this. They're seeing it on a daily basis in terms of how many people are using the space and what that space could look like for people. So really just trying to keep the communications open, doing the back end conversations now for what could lead to larger wins in the future. We have to, we're in the thick of the pandemic currently, but we also have to believe that we're going to get to the other side of this, and that people are, we want the long-term impacts to be positive after the shelter in place is over.
Excellent, thank you. So Sara, Sara did a good job of, just alluding to the question I want to ask next, which is, for some of you and many other places in the U.S., the initial measures that have been able to take place are, tend to be concentrated in like one spot or one road or maybe two. So maybe we'll start with Jim for this question, because I know you're thinking about this, Jim. How are you thinking? Do you think that more widespread, access to open streets needs to be, considered and implemented right now? And kind of how are you thinking through that? If you do agree, there does need to be more right now.
Sure. I think we're looking at a map of the city and first identifying all of the neighborhood-based bike pedestrian paths that are already in place that people can opt to use rather than going to our big waterfront destination trails. And then after we've done that, there's clearly some holes in our geography where the existing trail system does not suffice. And we're really trying to drill down in those areas and look at roads to fill that gap. And I think there'll probably be multiple phases of this. We rolled out the first phase, worked well. We're going to roll out a second phase. This isn't a time where anyone can support a lot of time-intensive process. And so decisiveness, supported by the streamlined public process that comes with state, federal, and local emergency orders, is a necessity.
Thanks, Jim. Anyone else on the panel wanted to chime in terms of, the need for having more open streets available outside of just one or two locations?
Well, I think we definitely believe that that's a goal that we would like the city to work towards, to ensure that enough space is available equitably throughout the neighborhoods. But that's and I think Jim put it the right way. This is about phasing things in, I think.
I agree. Oh, go ahead, please.
Oh, sorry. I just wanted to add, and for San Francisco, again, this is beyond just the COVID-19. We were very fortunate in that our board president for our Department of Transportation, they basically, after we won Market Street, they asked the city agency to come up with a list of other potential streets for car-free space. And so we found that to be a huge win, because it is the people that are realizing that car-free space are necessary, not only for what we see as Vision Zero, but also for the health and well-being of the city as a whole and its residents. And so it's just one of these things where we are looking at where the next possible space is, and that should be in all neighborhoods across the city. It doesn't matter to make it a lot more equitable that way. And that is also why we're trying to encourage people in every neighborhood to find more recreational space in their neighborhood and use that as a way during the pandemic.
Thank you. we've had several questions come in about how do we prevent overcrowding on open streets. I think, you know, a concern is in the same way that trails became crowded during this time, will open streets become crowded? You know, do they become too popular? And does that put them, you know, also at risk of being closed down in the same way parks and some trails have been? Jim, you shared a signage example to educate about social distancing. So I'd love to hear from all of you, you know, what are ideas about how can we be educating people about maintaining social distance while they're on open streets or temporary bike lanes? And, you know, are there any methods of monitoring or enforcement that have been discussed? And, you know, how can people work with local officials who might be, you know, concerned about this kind of overcrowding? So maybe we'll start with Jim again, since Jim, since the signage was, you know, referenced as part of this question.
Sure. You know, I think you know, our goal is not risk elimination; it's risk management. It would be impracticable and foolhardy to attempt to eliminate all risk by cooping everyone up. You know, we've got countless people working in at-home offices with children running around their feet, bored and underoccupied. There's no wise path forward where we simply shut down access to the outdoors indiscriminately. So the question is, how do we minimize those risks? What are the places and activities where those risks are simply excessive, cannot be reduced enough? And what are the risks that we can live with?
Thanks. Anybody else want to chime in on this question?
We've basically been echoing the mayor's message as much as possible in terms of the 6-foot distance, and also kind of giving people a heads up that if we don't keep that social distance, we might lose this park space. So not that I want to increase fear in anything else, but again, trying to keep people in their neighborhood, focus on their neighborhood. And the mayor's message has been literally only for necessity should you be going outside. I definitely understand, Jim. I mean, families with children and trying to just, you know, get people out as much as possible, especially since in San Francisco, the weather's been great. I mean, we have sunny mid-60s. It's like ideal. So we are just trying to encourage people to keep a safe distance, use your neighborhood as your recreation space.
And then the second part of the question, do any of you have some wisdom or advice to share for, you know, people who are, you know, working with local officials who are concerned about this? You know, kind of what's your advice? What's your advice to them?
You know, this is Jim in Duluth. I think send city officials your ideas. We received an idea unsolicited yesterday from somebody who suggested a specific road to close and dedicate to bike ped, and it was a great idea, and our team has started developing and exploring it. And there's never been a time where we more needed good ideas from a diversity of sources. So share your ideas.
Great. Anybody else want to chime in on that one?
I guess I would just, yeah, I mean, I think Jim previously said it really well. It's going to be incredibly difficult to keep everyone inside 24/7. So, you know, you can imagine doing that and I guess some cities around the world are trying that, you know, but that's not a long-term strategy. And if there's only one spot in a big city that's available, then it's going to get overcrowded. So it's better to have more spaces, more distributed, to help reduce that density or that, you know, overcrowding to one area. And I've never, you know, all of us, I think, have never been during a time when people are listening to their elected officials. and we've just got to, as Jodie said, we have to keep echoing what they're saying, and you know, and be, you know, be good stewards of the, you know, we're all, you know, in this to, you know, the saying, we're all in this together. But you know, we have to be listening. Everyone is listening. Everyone is scared, and you know, and so if we can follow directions, we can, you know, then we'll be able to use it.
Such great points. Thank you, Sarah. I'm going to direct this next question to you, Laura. How do you recommend, or what is Bogota thinking about, you know, as the pandemic, you know, changes? Hopefully, you know, once it starts to go down in intensity, how do you foresee the changes you've made changing as the pandemic changes? And you know, over the long term, how do you make those changes? And what kind of, you know, data do you think the city will be looking to guide those decisions, since you showed such a rich access of data that the city uses?
I think one element is the ongoing plans that we had, because some of the corridors that we implemented are already in these plans, and we were looking about how we make it permanent. So we saw the opportunity to make a trail and identify how the people behave. Of course, it's different when you had the whole cars and the whole public transport there, but we think it is the opportunity to make it real. Uh, we we take this time to plan, to analyze, for example, how useful is for medical, for health workers, or doctors, or how we can use this for this moment and in the future. um, and also I think we have to be more flexible a little bit with these laws and all the plans. So I think the data is very, very good, but it's changing all the time, all the people, and so our big challenge is avoid that the people take motorcycle or cars as an individual transport system, so it will be a collapse.
Thank you. Question for anybody who wants to jump in. What role can the private sector play in supporting COVID-related open streets and you know, other kinds of traffic calming and temporary bike lanes, things like that?
I guess it would help if they would call for it also, and be publicly supportive. It would help if they would sponsor it. I mean, we're famous for being the poorest big city in the country, and so, you know, resources for us is incredibly important. So I mean, I think getting engaged in this kind of public civic dialogue would be really welcomed.
Excellent. Thank you.
If I can chime in, also, I think, you know, supporting the advocates that are doing this work in many ways, and calling us and asking us how they can support, how their voices can be leveraged, I think is also a good way to help. Advocates are, you know, we're the ones at the front lines. We're the ones that are really trying to make this happen and mobilize so many different groups of people. encouraging, like if we do put something out, asking, being, thoughtful about giving it also over to their employees who might also want to be participating in this, and letting them know that this is happening, I think also is a huge help. And then to companies like Waze, Lyft, Uber, Google Maps, and things like that, if we do have any kind of car-free space or people where there are more people biking and such, to make sure that their apps are changed so that they're not directing their car traffic in that direction, but keeping those areas free and clear so that people can have those space.
Excellent point. Thank you both. Another question, what considerations should advocates take into account when approaching local government with proposals at this time? What kind of information would be most persuasive, especially in places that maybe don't have previous experience with open streets and this kind of temporary bike ped infrastructure?
I'm happy to jump in. For San Francisco, I think seeing is believing. And what we did to try to get folks to realize that we needed something like Bogota, we had to show them what really works and what the numbers are and why this is really good. So I think pointing to other similar size cities, to other cities that are doing this, to having even places that would be willing to have conversations with these other elected officials and what have you, in terms of maybe the why we were opposed to it and what happened in our city when it really happened. That is one recommendation I would have in terms of city peer-to-peer groups talking about what really impacted the change in that way. But I also, examples from other parts of the world, it's what we really use to drive home in terms of why we need this kind of open streets.
I think data helps a lot. If there's any possibility of doing counts safely, or if there's access to data from automated counters, I think that helps drive home especially if there are areas that are being very severely overcrowded.
Okay, great. Teeing up our next question here. So what do you think is the biggest obstacle to convincing those with the power to open up streets for pedestrians and bicyclists during this time?
Well, I think there's probably two, right? I think there's the fear that it has been mentioned before, the fear that people will not exhibit, will not practice safe physical distancing from each other, so that it could, in fact, exacerbate the problem rather than lessen it. And I think the other factor is cost. I think that there is for us at least, if closing a street requires police presence or barricades or jersey barriers, those are resources. And so it's the sort of the operations of it that I think probably factors into decisions about whether or not it's really possible to pull it off.
I agree. I couldn't have said it better. Thank you, Sarah.
Okay, so one more question, and it's some of the themes we've been hearing from people, but I'm going to say it in my own words. How do you see, with whatever you've been able to accomplish and implement, how do you see that being able to carry through and have more safe spaces for pedestrians and bicyclists? Make sure that your work endures after the pandemic wanes. So, once life goes back to normal, whenever that is, no one knows. But the successes that you've been advocating for right now or implementing right now, how do you think you can sustain that after we're out of this crisis period? Maybe we'll start with Jim again.
Well, I think the way to get the most traction on active transportation in this crisis is actually to entirely put aside the active transportation agenda and dedicate your organization's efforts and thinking wholly to the narrow, compelling problem of helping communities get through this. Public leaders are just swamped with emergency decisions right now. And as much as I share the active transportation agenda, if somebody called me and it was clear they were pushing an active transportation agenda, I would not have time for them right now. But if they called me with an idea to help us get through this that happened to have active transportation dimensions to it, I'm all ears. So I guess that's my 2 cents.
I love that. Laura, how do you see the changes you've been implementing now, impacting sustained change, after the pandemic goes away?
I think it's very useful to change the normal life of the people. Actually, we live now very different as 1 month before, and I think this change and this routine was broken, so we can build a new one. And this offer of spaces help to make this decision, because a lot of people in Bogota, for example, use the bike just on Sunday and doesn't use it to go to the work or to the university. They feel insecure, and we are working very hard not just to give the spaces, but also speaking with the police department and identifying these places that make the people feel insecure, and try to make it better, or uh, act if something happened. So I think we can use these very low numbers of people that go outside, and show them another face of the city. But we can make better, maybe in a couple of weeks, or when we it depends on what happened next. But I think we should work on maintenance, on the light in the city, make it better, um, and identify the new expectations of the people.
Excellent. Sara, Jodie, any last words in regards to this question?
I wouldn't mind chiming in very quickly, and then Sara, you can have the last word. For us, with 1,400 people signing on to our petition in just less than a week's time, I mean, this is more members than Walk San Francisco has. This has shown that there is a deep want and need for car-free space. So it's really up to us now as an advocacy group to harness that energy, raise those voices, continue to communicate with those folks. Only 46% were people from the surrounding park area. So that means there's more than 50% from other areas of the city. And so this is a great opportunity for us as an advocacy organization to really listen to the people, see what they want, and really figure out where we can bring car-free space to other parts of San Francisco and win JFK car-free 7 days a week.
Thanks. And final word from you, Sara, before we wrap up.
That's a lot of pressure. I do think, I think that this is, we're going to have to just keep having these kinds of, even if they're difficult, they're great conversations about expanding car-free streets, whether it's in our parks or, maybe hopefully expanding our Philly Open Streets program. And I think make the point that there's a lot of appetite for this. There's a lot of desire, a lot of demand, and it can be done during an emergency, but it can also be done, better not during an emergency. So that's what I'm hoping we can, in a sense, just continue to have to sort of broaden out the use of streets for people as much as possible going forward.
Wonderful. Thank you so much. Thanks to all 4 of you. You did such a great job. I learned so much. And then just a friendly reminder, we have built a really wonderful resource page specifically in response to the pandemic with all kinds of great resources on it. So we really encourage you to go there, and we'll be adding to it all the time.